Yeah.
I truly believe direct primary care is at the forefront and needs to be on top of mind for every employer, right? Because long term, they reduce the overall spend of their employees, and it helps employees become better consumers once they're able to have those conversations with their direct primary care physician. And Wayne, we need more people being good physicians.
Yeah.
We need good hospitals. Hospitals take the brunt of a lot of our angst,
Yeah.
and rightfully so, because there's good hospitals and there's bad hospitals.
Yeah.
But we need more physicians and nurses. We need good people in healthcare getting in, not getting out. And we need the employees and their members to become better consumers.
Hello, and welcome to the best DPC Podcast, the world's #1 show covering all things direct primary care. I am your host, Wayne Lowry, and today I am honored to have Rich Hess with us. Rich is the VP of Business Development of the Plexus Group, bringing in over 30 years of employee benefits and insurance experience to the table. Today, he's going to tell us how we can unbundle insurance and provide direct primary care as a part of that package. So we're excited to have Rich with us.
Thanks,
Welcome,
Wayne.
Rich, to the
Glad to
show.
be here. Always love talking direct primary care.
So tell me, Rich, a little bit about yourself. So where did you start your insurance journey?
Wow. So probably like most folks in the insurance business, I was tricked into it, right? I don't know that anyone grows up thinking they'll be in the insurance business. But my senior year of college, I started going on job interviews, and I ended up on one of those interviews at a third party administrator, TPA. And at the time, they were very small, local. And my thinking as a 21-year-old, 22, whatever I was that by getting in early, being on the ground floor, right, that I would have more opportunities to grow with the company. And so I started out at a third party administrator, learned how to pay claims, do billings, really do anything required, and ultimately ended up hiring a sales force and growing the sales team and expanding lines of coverage and so forth, to the point where I decided to just go out on my own.
So you're talking about
Yeah,
TPA. So let me jump in for a second. So for our listeners who are not familiar with what a TPA is, I know you mentioned it briefly, a third party administrator. A TPA is obviously very crucial if you're going to have some sort of, I guess, self-funded plan. So tell me a little bit about what you were doing. Were you working with uh, like self-funded plans primarily, or what were you kind of doing with
yeah, great question.
that company?
Because there are, in fact, very different types of TPAs, right? Third party administrators. In this case, we specialized in Section 125 cafeteria plans or flex plans, right?
Okay.
And ultimately, we got into COBRA, administering COBRA, et cetera. But in my case, we were administering and selling the Section 125 cafeteria plans. So my role was to work with employers and help them understand how the cafeteria plan was advantageous to both of them and their employees. Ironically, I had a really good friend. We're still good friends today, who we went to school together. And when he graduated from college, went to work for his father at a TPA who administered health plans. So we both got in the TPA business.
Okay.
Me focused on
Totally different
cafeteria
direction.
plans, him focused on health plans. And so oftentimes we were competing for the same employers, right? But having grown up together since like
Yeah.
fifth grade, we would go to lunch and catch up and lie to each other, right, about what we were working on because we didn't want the other one to really know. But oftentimes we ended up in the same exact employers as competitors.
So you say as competitors, so how could y'all coexist
So
in the
there were
same
times
employer group?
where the TPA he was working for was uh, administering their self-funded medical plan. And they had a lot of clients who were in MEWAs or trust, um, a banker's trust, for example, where multiple employers could join to an extent the same plan. But we would administer the cafeteria plan for that same employer.
And now for our listeners at home, a cafeteria plan, we're
No.
not talking about your meal plan. We're not talking about your fruits and veggies. So, what is a cafeteria plan in the role of
So
the
the
TPA?
gist of it is the reason the IRS calls it cafeteria plan is because you can have multiple benefits that an employee can pick and choose from. Much like when you go through a FERS or a Lubies. Hopefully most of our listeners are familiar with FERS or Lubies. I'm going to have the
Well, if you live in like the Oklahoma Dallas
surely,
area, I
huh?
think you know it first. So why don't you do a Brahms reference? Let's keep it
Yeah.
ultra like
Well,
hyper
unfortunately,
local.
Brahms doesn't offer cafeteria style, right? You only get what you pay
Oh,
for.
oh,
I
oh,
might have had
gotcha.
Brahms yesterday, as a matter of fact. Some chocolate almond.
Well,
Yeah.
thanks for rubbing that in. So they call it a cafeteria plan because you can pick and choose. So these are typically your
Well,
voluntary
certainly
products,
voluntary
right?
product can be a piece of it. They can be something that the employer offers to their employees at their own expense. What we were responsible for as the TPA was administering what's called flexible spending accounts. One for medical
Okay.
expenses, one for daycare or childcare expenses. Technically dependent care expenses, because it can also be used
Yeah.
to pay for the care of an elderly parent, for example. Uh, Something that my
Gotcha.
wife is going through right now with her dad. All those expenses related to an aging parent. But what we did is we would educate employees on Section 125 and how they could have money taken out of their paychecks prior to any withholding tax and then be reimbursed tax-free for those expenses for out-of-pocket medical expenses, such as deductibles, eyeglasses, dental work, co-payments, prescription drugs, et cetera, et cetera. And as a TPA, that's what we did.
So not to not to bury the lead too far. So with the TPA side and what you're talking about those selections, what are your thoughts on how to involve DPC in those type of
Well,
plans?
so what I've been recommending for some time now, and I love the popularity of the DPC, how it's grown just in the last few years. From my vantage point, it's grown significantly. I think employers still have reservations, right? Um, and those are some things that we talk about all day, every day is how DPC can help them and help their employees and help the overall health plan. Um, but to me, most of the conversations that I'm having are, how and why should we have direct primary care at work? Uh, and I've been a fan for some
Okay.
time. I think years ago we got away from primary care physicians, and I know using my sons as an example, I have two sons, both one is 29, one is 25. And their age group, it's all technology, right? And it's all cell phones. And for one of my sons, when they don't feel well or they feel like they've reached a point that they might need a doctor or a prescription, their tendency is to just grab their cell phone, find the nearest urgent care. What time can I get in? Pay the $75, go to Walgreens or CVS, fill the script, and off they go. They don't have primary care physicians, right?
Right.
In an employer setting, Wayne, the thing that I hear the most is, I'm talking to a CFO, let's say, and I'm looking at their plan.
Yeah.
And I start having the conversation about direct primary care and how it can keep people out of the emergency room for things that aren't an emergency. They can get certain services in the primary care physician's office without the added expense of the hospital, or in some cases even the pharmacy, because some DPCs, as you know, have a lot of the drugs in-house, and they can just anyway.
Yeah, depending on the state, because down here in Texas, we've kind of covered this a few times. Down here, it's always a talking point because in Texas, you
Can't
can't dispense at your clinic. So I think it's us and Massachusetts, if I remember correctly, are the two states with the strictest regulations on that front. But I guess Oklahoma, it's just free willy nilly. I mean, y'all legalize marijuana, now you can just get drugs anywhere. Is that what you're telling me?
Oklahoma is in the right, one of the freest, most conservative, independent states in the union. Isn't that right?
It is, and boy, you can still
I
get high.
love my state. I love
Plug
Oklahoma.
Oregon.
I think one of the reasons we've remained the way we are is because people just don't care about Oklahoma. Like, right? When I was in the Marine Corps and I was all over the world, people would go, "You live where?" "I'm in Oklahoma." "Do they even have roads?" Right? So we just kind of sat here and mind our own business.
Yeah, they just plucked you. They plucked you right
Yeah.
out of the
I
field in
mean,
your bare feet, right? And
yeah.
sent you off.
We
Is that
ride
what everybody
horses to
assumed?
work and
Well, I think it's interesting because recently we got a chance to go see the see each other at the FMMA conference and to see all the DPC innovation that's going on in that area. And there's a lot of excitement in that area around DPC. So one thing that I can tell people, listeners at home, whatever your thoughts are about Oklahoma, they're wrong. Oklahoma really is. Oklahoma City, especially in the Oklahoma City area, is really thriving in a lot of different fronts, economically speaking. And so maybe a lot of that freedom you're talking about is bringing in some unique
right.
and new
Good
business
point.
opportunities.
Capitalism.
So that's exciting. That's capitalism. Good for you guys. As long as y'all aren't
Yeah.
beat us at football, we'll be okay. Um, so let me ask you: when you're talking to employer groups now, uh, and you are trying to bring up DPC, what are some of the challenges, or what are some of the education points that you deal with in those
Yeah. So that's what's
conversations?
interesting. The number one thing that I hear is, "So you want me to spend more money to fix my health plan?" Right? And oftentimes
Yeah.
I'll just kind of chuckle because I get it. It does sound counterintuitive, right? But Wayne,
Mhm.
it's so much like any wise investment. And I could go on and on about different scenarios. We all hear it takes money to make money, or you have to spend money to make money, right?
Oh yeah.
One example that I give oftentimes, and people laugh at first, and then they go, "Well, yeah, now I do get it." But I don't know if you're familiar with Lululemon, the brand. Okay. Have you
Yes.
ever worn a pair
Yes,
of
I am.
pants from Lululemon? Okay,
I'm gonna say
good. Well,
no.
you're in South Texas, right? So I
Yeah.
have I have Lululemon pants on right now. But here's where this
Okay.
story gets interesting. I'm known to be very frugal. I don't like to spend too much money. I don't like to waste money. I'm not fancy. I'm very conservative. Um, I have clothes in my closet that I've had for years and years and years. Just can't get rid of them. I wear old shoes until they literally fall apart. Like, I am very conservative and frugal. I don't spend money. Okay. And I have taught my sons to pay yourself first, put money in the bank, save, be conservative, don't overspend, all that stuff, right? No credit card debt. A few years ago, I went into a Lululemon and tried on a pair of pants.
Now, let me ask you real quick. Do Lululemons come in Levi?
I have Levi's.
That's really
too.
my question.
They do not. I suspect
Okay,
Lululemon and Levi are
okay,
two very,
okay.
very different companies. I'm only speculating.
Okay. All right.
All right.
Okay.
And I
All right,
promise there's a
just
point to the
checking.
story. But when I'm talking about direct,
Just to be clear, when we go to commercial break, we're not going to
that's
break
right.
for
They are
Lululemon
not a
commercial.
sponsor.
So
We're not endorsing Lululemon
not a sponsor.
by any
Yeah,
means.
no.
I would have
Buy
been the
them at
last
your own.
person you would ever expect to go buy a pair of Lululemon pants, is my point. But I went in
Gotcha.
one day and I tried them on, and I literally looked at the young lady helping me and I go, there's no chance I'm spending $158 on a pair of pants. No chance. Maybe 128. I don't remember. But I won't do it. Okay. A few days later, went back, tried them on again, bought them. Okay. Since then, I decided, you know what I'm going to do? I'm just going to buy 4 or 5 different colors. And it'll save me a lot of time and a lot of effort just knowing exactly each day, here's what I'm putting on. Told my oldest son about it. He laughed. No chance I'm spending $128 on a pair of pants. I go, I get it. You're just going to have to trust me. You're just going to have to trust me. And that's where I end up with a lot of these CFOs, Wayne. Because now my oldest son, he has every color of those, and that's all he wears for work. He can dress them up, dress them down, put on a golf shirt, wear a blazer, but they're flexible.
All right, so for those that are watching, I found an option. Now the guy is holding a handbag, but besides that, it looks very masculine pair of pants right there.
So,
all right,
they're
they
very
look comfortable. All right,
they're flexible.
I
But here's the thing: like when I told my oldest son, "You're just going to have to trust me." The moral of the story was, we've all skimped on stuff where we bought something cheap or inexpensive or etc., and it either doesn't last, doesn't look good, not comfortable, whatever. And I'm the world's worst, right? I'm guilty because I don't like to spend money. I prefer to save money. But it saves my son and me, for that matter, so much time and effort on going back to other stores, shopping, being frustrated, blah, blah, blah. And with DPC, so many times now when a CFO or business owner says, so you want me to spend more? Like now you're telling me I got to pay X amount per employee per month when my health insurance already covers doctors? Yes, you're just going to have to trust me, because what that's going to end up doing is reducing your overall cost of your health insurance.
So what do they say when you use that approach?
A few years ago, they would go, yeah, I don't know if I trust you that much. Right? Isn't there something else we can do?
Yeah.
Well,
but 10% year over year increase of their premiums may have something to do with some motivation.
It's funny you say that, because I've come to the point in healthcare where I truly believe that the only way employers are going to make real change is when the pain of what they're doing now becomes more than the pain of the unknown.
I want to take a quick break to talk about bestdpc.com. Are you a doctor looking to break free from the headaches of insurance and take control of your practice? Or maybe you're an employer searching for an affordable healthcare solution that actually works. At bestdpc.com, we cut through the noise. and connect you with the country's best direct primary care clinics. Whether you're a patient tired of surprise medical bills or a physician ready to build a thriving membership-based practice, we've got the tools and resources you need. Find the best DPC doctors near you, get expert advice, and take the first step towards a better healthcare. Visit bestdpc.com today and see why direct primary care is the future of medicine. That's bestdpc.com, because great healthcare should be simple, affordable, and built around you. Yeah. Well, what we say is no one gets fired recommending one of Buka. So when you're talking to, an HR department, or you're talking to some of the decision makers that maybe aren't the CEOs, if you're talking about a private sector, company, the CEO might be willing to take the risk, may be willing to roll the dice, take the gamble, but the HR department may be sitting there going, "Hey, I've never been fired for looking at a fully insured, stack from one of the big carriers. So I'm going to keep doing that because, hey, I'll have a job tomorrow." But it sounds to me you're getting to talk to some of the decision makers, and y'all are, again, Oklahoma. Y'all are still the Wild Wild West, right? So I mean, you've got some gunslingers that are willing to give it a shot. So what have you seen? And obviously, getting in the front door, you build that relationship, you have those clients that you're integrating with DPC. What are some of the results that you're showing from that?
That's the answer to your question. Is it used to be you're just going to have to trust me, right? And while I might have overspent on a pair of pants, 5 years later I'm still wearing those, and so I didn't have to buy more pants. Now we have statistics on DPC. We can show where here's your claims before DPC, here's your claims since. And we can show where the claims, maybe it's emergency room visits, right? Maybe it's high dollar claims. Yeah.
Urgent care.
Now we have employees who are using direct primary care instead of urgent care and emergency rooms. And one of my favorites to show is, so if an employee goes in and the doctor says, well, we might ought to x-ray this just to be safe, right? Or you need to get an MRI, or whatever they suggest. Well, when you have DPC, they aren't incentivized to run extra tests. And so we have those diagnostic bills coming down. We now can show overall claim spend coming down on employers who have DPC versus those who don't. Whereas before, I used to have to say, well, you're going to have to trust me because I think it's going to lower your claims. We can now show them.
Yeah. Well, it's good to have. And so changing the discussion from a trust me bro to here's the data. I mean, that obviously you go from the hunch to the success. I don't know if you were at the presentation, but it was pretty cool listening to Frontier Direct Care present on their success with the city of McAllen and what's going on there. And I was a part of that organization when some of those initial conversations were going on, and to hear and to see, changing the conversation from trust us to, here it works. And so let me ask you, so as a DPC, so let's just say they're in Oklahoma City or Kansas or Montana or Florida or wherever you have a client, and you're putting together a plan for that client. How would a DPC either reach out to you or do you reach out to them? How do you identify the right fit? Because not every DPC, I mean, let's be honest, not every DPC is ready for this, nor maybe they don't want to. And you got to respect, a lot of the DPCs that I've talked to and know, they want, for lack of a better term, a lifestyle business. They want to have their business. They might have one MA that helps them out. But other than that, they don't want to take on more administrative They don't want to have reporting. They don't
And
want to have
good
to
for
be a part
them.
of an employer plan. And exactly, like, God bless you. That's a great thing. You provide a great service to your community, and you take care of your family. But there are others that are more um, maybe entrepreneurial minded. Maybe they have one or two clinics, one or two locations, um, and they're saying, "Hey, we want to take on some and employers. We think we can serve them very well." How do you find those DPCs? I mean, obviously, go to the bestdpc.com
You
to
have to
check
start
the
there.
directory. Obviously, first step, but you got to start there. But after that, how do you narrow down the choices
Man,
to
that's a
find the right
great
DPC
question,
partner?
because it's not a one size fits all. I'm fortunate to have been
Yeah,
in the business a long time, and to have been in this community, and so I know some of the folks who have gotten in the business, and we just started having conversations several years ago. Um, and then the last 7 years prior to me joining the Plexus Group, I was actually on the network side of the house. So I worked for a
gotcha.
company that created a regional, narrow, high performance network. And so I was having conversations with Frontier, right? I was having conversations with HEB, the grocery store who has their own clinics, and now they've gotten into DPC, right? In
Yeah,
Oklahoma, Primary
right,
Health Partners, as an example. So
right,
it all depends. We have to, as a consultant, vet them out, right? Like, what are their goals? Where are they
right.
located? I always try to keep in mind that healthcare is and should be local. So
Yeah,
it's funny, about 2 years ago, I put something on social media, maybe LinkedIn, about Primary Health Partners in Oklahoma. I think they're a great outfit. I love the people
yeah,
over there. And when they first started and I was visiting with them, we'd go to lunch or we'd go have coffee, and I was asking a million questions about how does this work and how do you do this and how do you do that and
right.
why would somebody join? Um, and we became friends and allies in the healthcare arena. But anyway, a couple years ago, I put something on probably LinkedIn, if I had to guess, and somebody called me, and they were with a TPA, a self-funded TPA, and they said, "Hey, why are you talking about them on your social media?" I go, "Well, because I think they're good people and it's a great service." He goes, "Oh no, I agree. We think they're great, but what's in it for you?" And I said, "Well, there's nothing in it for me, right?" "Oh, come on, there. I mean, why are you talking?" Listen, there is nothing in it for me to recommend direct primary care. It's where healthcare is headed, and it's what we should be doing.
Yeah,
So if I'm going to be a consultant in this
yeah,
arena, this is how I make a living, then
yeah,
I'm going to point people in the
yeah,
right direction. So
right.
to your question, I try to do my homework, vet them out. Oftentimes I will recommend DPC, to your point, like if there's a DPC practice and they don't want employer groups necessarily, they just want their
Yeah,
hey, go check them out, see if they're taking new patients. If they are, sign up. There's nothing in it for me. So it's a
right.
matter of finding the right DPC practice for the right employer.
So let's say you have a DPC that they have a patient panel of. Well, let me back up a step. What are you what are you seeing most of your um, the employer size? Like, what are of your book of business? Are you typically talking to 300 member groups, 1,000 member groups? What's kind of your sweet
Um,
spot?
I will talk to any size employer, right? Um,
That's the right
and
answer.
I
Good
don't. I
job.
mean, somebody called me last week. They were referred to me, and they have two employees, right? And so I went through
Yeah.
the normal questioning. Um, you should probably just be with somebody right now, with somebody who focuses on individual, right? You can check the exchange, you can get a small group
Policies.
plan, etc. But I'll talk to any size employer.
Right.
As if you talk about our sweet
Gotcha.
spot, it's probably between 100 and 1,000. We certainly have several groups over 1,000. In fact, you mentioned one of them earlier. They're a client. They might do ice cream. And so we have several over 1,000 lives. And of course, we have offices in Dallas and Chicago as well. So we have many large, but I would say that sweet spot is really where it's catching on, if you will, is between 300 and 1,000 lives.
Take a quick break to talk about scalebyseo.com. If you run a direct primary care clinic, you already know the power of patient relationships. But here's the thing, patients can't sign up if they can't find you. That's where Scale by SEO comes in. We help DPC clinics get seen where people are searching, so you're not just waiting for word-of-mouth referrals. With the right SEO strategy, your practice becomes the obvious choice when people are looking for better healthcare options. If you're not showing up where they're searching, you're missing out. Be visible, get found, grow your practice. Don't leave growth to chance. Visit scalebyseo.com today, and let's get your clinic in front of the right people. So a lot of these employer groups that you're dealing with, I'm sure they're not necessarily isolated in one vicinity. So if you've got a large employer group, you may have 30 people in one town and 50 people in another town. Like, how are you integrating DPC when you've got clients that are that spread out? Or is most of what you're finding is it really works if they are, a municipality or a school district or just a large centralized employer?
Yeah.
What are you seeing?
No, you're exactly
as far as
right.
integrating DPC?
And again, I have a little bit of a unique advantage in that the last 7 years I was on a regional high performance network side of the house. And we were oftentimes focusing on municipalities, counties, public entities, schools, where employees were consolidated, if you will, within 25 or even 50 miles. We have in Oklahoma, of course, we're blessed to have the oil and gas and energy businesses. Good news, bad news.
Yeah.
Good news is lots of jobs and well-paying jobs. Bad news is they will oftentimes be in 13 or 14 states. So DPC, they kind of might not be super excited about DPC, maybe not super excited about a high performance network because they need to be able to cover everyone in the other states. So what I see normally is, to your point, they will be consolidated in most cases, maybe even have a direct primary care entity who wants to build them their own clinic. Right? I talked to an oil and gas company in Oklahoma and I said, hey, you could have an on-site or near-site clinic and or DPC. And while they loved the concept, said, well, we don't want to do something different for those folks than our folks up in North Dakota. Fair.
Yeah.
But then we can get telemedicine, right? Maybe even traveling nurses for them.
Your site, or maybe not the same DPC, but maybe
correct
a DPC in that community.
And so that's mostly what I'm seeing is they either employees are consolidated within a certain geographic area, or they find other entities or services for the ones in the outlying.
Gotcha. So let me ask, if you were to reach out to DPCs, what do you need from a DPC? Like, what do you need as far as reporting? Do you need certain data? What do you look for if you're going to even start a conversation with a DPC?
Early on, I just want to know about their culture. I want to know why they're in the business, right? And I don't care if they want to charge $50 or $150, but I want to know that they're in it for the right reasons. And then what are their long-term plans? Do they plan on scaling and going to other communities, or do they have plans to just be in a certain community and this is it? Here's the max number of employees. Either way is fine. I just need to know what their plans are, right? So that when I am talking to a prospect or client, I know how to line them up. And we need good hospitals. We should partner up with the hospitals. If we can get direct primary care in health insurance and good hospital contracts direct with good TPAs, then the cost of healthcare goes down.
Yeah. Yeah. There you have it.
Sorry.
We solved it. We solved it today, right here. We solved it. Now, if we can just convince people, now if we can take our show on the road and
education, right?
and yeah, and push the education. Well, I want to say how much I appreciate you being on the podcast today, Rich. This is very insightful. I want to encourage all DPCs everywhere to be mindful of what a health plan is and how they can be integrated into a health plan, because we're all taxpayers. I've done a lot of work in public sector, and when you're talking to a public sector, these are tax dollars at work, and I'm not sure if you've worked specifically in that sector, but in public sector, these are our tax dollars we're talking about. Like, well, let's not waste our money paying for something to help some suit in New York City or Chicago. Let's try to help our teachers, our city employees, and let's try to provide a benefit that keeps it healthy, keeps it local, and DPC can be the front door of that access. And so I've loved this conversation. I hope you'll come back sometime and maybe sit down on a panel with a couple other people in this community and see where we can drive some change. So
yeah, I'd love to do that.
Awesome. So how can people find you?
R Hess at plexusgroup.com. Group has an E on the end.
Oh, an E. So
yeah,
so that
Group
so
E.
it's time for me to tell my joke. It's now time for me to tell my joke, which is there's no E in Lowry. I let you have the E for
Thank
group.
You.
So there you go.
We appreciate it. There's an E on the end of group. Or 405-823-1127.
What are those random digits that you're spouting?
I give my cell phone to every client. Call me, text me. I've had that cell phone number for 30 years.
All right. So you can reach them by phone. Also, I imagine you'll have a website, plexusgroup.com. Is that right?
Plexusgroup.com. Group has an E on the end of it.
All right. Plexusgroup with an E.com.
That's right.
To check it out. You can find Rich. What about LinkedIn? Are you on LinkedIn?
Absolutely.
All right.
You'll be able to find me on LinkedIn. I'm even on Facebook.
Oh man, Facebook.
I know.
Don't age yourself. I thought you were going to say TikTok. So either way, we'll make sure to have his contact information in the show notes. Again, thank you, Rich, for joining us. And for more DPC insights, head over to bestdpc.com. Don't forget to follow us on social media. Subscribe to your favorite podcast platform. Make sure you give us all those likes and those stars. We live on those things. So we appreciate it. And until next time, your health matters. So demand the best with direct primary care. Bye-bye. Best DPC Podcast. We're spitting truth on the mic. American healthcare stinks. A maze of red tape and greed that's out of sight. It's time for new choices. A revolution in care, where every heartbeat matters. Cutting through the noise with the record.